Hi, Dr. Gumbs-Tyler. How are you?
I'm well. How are you doing today, Dr. Maura?
I'm doing great. Well, thanks for joining me. We're going to talk about, gut health is one of my favorite topics, and you're the pediatric gut health specialist. So we're going to chat a little bit today. So we know that a lot of disease starts in the gut. This is, nowhere more true than it is with kiddos. But what age do you stop paying attention to your child's bowel health?
I love that question because my professional opinion is that we never really should stop
Mm,
checking on our children's bowel health. When they're infants, we're trained automatically as parents to check how many diapers. Then
yeah,
somewhere along, and we help them go to the bathroom. And at some point, when they're able to go on their own, we just make sure that they go.
right.
But we may forget to actually check and say how many times a day or how many times a week are they actually having a bowel movement
Yep.
versus urination. So we should always check. And I would say especially as they get older and maybe less likely to come with us with a problem until they're really uncomfortable or really struggling, it's better if we can proactively check in every once in a while and let them know that it's okay.
Right. Look at signs and symptoms. And you're a mom of four kids, so you should know this better than any of us. I'm also a mom, but you've walked the walk here. So when you're looking for symptoms around the gut, what are you? What are signs and symptoms? I know it's not just stool, although we should look at stool if our kids are going to let us. What else are you looking for?
Right, that's a great question. So I can say some of the questions I check in with my children and I think are good to check in overall are um I usually just ask them how they feel after they eat and help them to become aware. So if they notice that they feel their stomach or their digestion doesn't feel quite as good after they eat certain foods, they're starting to make the connection. Um, Definitely, if all of a sudden we have a lot more gas, whether it's coming out of the mouth as burps or coming out out the other way as passing gas, or if we have a lot more bloating, that big belly swell after a meal,
Right.
those can be signs of issues. Um, Changes in eating habits, whether all of a sudden they don't want to eat certain foods or they want more of certain foods, like maybe more carbs or breads could possibly be comforting um,
Mhm.
an irritated stomach or staying away from certain foods, dairy or spicy, could be, or tomatoes, for example, could be signs like they used to love pizza, all of a sudden they can't stand pizza sauce or tomato sauce. That could be related to GERD or reflux.
Right.
Um, or just not eating as much, especially with constipation. If you're not eliminating, then your body's going to have less and less space to
Right.
actually add more food in. So sometimes children won't express it, but then they just are not hungry.
Right.
And I would say for younger children, parents can still just check, maybe do an underwear check as they're doing laundry, see
Yeah.
if there's any stains or anything else like that. And
Right.
then lastly, I would say something that we don't always think about is changes in skin, especially
Mm,
as children are getting older and even, adolescents. Acne can be a common thing, but often acne can be tied to our gut health.
right.
So any rash outbreaks
Hmm.
or big, pimples or bumps all over the place, that could be a sign that we're just not eliminating
Right.
properly.
And so many of our pediatric patients come to us with other issues, like we were talking earlier about the atopic triad, right? Allergies, eczema, and asthma can often link to the gut because our gut has, our immune system primarily. So, we're looking at the whole constellation of symptoms, as you're saying, your skin, immune system, all the things, right? So, and you touched on constipation. So, what would you say? I mean, that because that's one of the big things we see, right? When we're talking about
Right.
kids and gut health, constipation. What are some antidotes to that, or what would you? I would say first, like what causes it? I'd say they're connected a bit.
Right. So first, I'd like to say, constipation generally is defined as less than three bowel movements a day, a week, I'm sorry, which is maybe like every other day.
Right.
I think usually we like to see someone go on a daily basis.
Yes.
Um, but even if someone is going, if it's very small, small stools, or hard to pass, or if they're hard, that can also be a sign of constipation. Sometimes people say, "Oh, I go every day," but it's not a full stool. So that
Right.
is a sign of constipation. There can also be maybe a little bit of blood. So how do we fix that, especially with younger children? We don't want to just go get a Malox or something to cause them to, a laxative, give them a laxative to help them eliminate. So,
Miralax or something, right?
right, Miralax, exactly. So we should start with making sure they're getting enough fiber and as fruits, vegetables, beans,
Mhm.
like other legumes, nuts, seeds, and also whole grains and not a lot of processed food and not too much sugar. We also want to make sure they're drinking enough water and not
Yeah, that's
juice,
a big one.
soda, coffee. Some children start young on the caffeine.
True.
So we want to make sure that they're getting enough water to keep their bodies hydrated. And even if you get enough fiber, if you don't have water, you're just going to get that bulk in your colon and it's not going to come out.
Right.
And also physical activity. So sitting can slow everything and stop back, like it's like a stopper, back up the flow. So we have to get up and stretch and move our bodies
Yes.
um, every day to make sure that we can move our
Yeah.
stools
Less
through.
less screen time, more moving.
Yes, exactly.
Go outside. So when you talk about so those are great approaches. When we're talking about functional medicine, naturopathic medicine, which you're so good at using for these kids, what kind of tools do you use as far as diagnosis goes, and what are some naturopathic treatments that we would use? I know it's so personalized, but what are some kind of basic ones or generalized ones that you use?
Right. So aside from just understanding the true history and I just want to throw in everyone's not constipated. Sometimes it's an irregular loose stool or
Mhm.
not maybe not diarrhea, but it's just a little bit loose. So if we need more information, we can do a stool test where we actually are evaluating the person's stool a sample of their stool and seeing what the makeup is. Are there any is there bacterial imbalance? Do they have enough of the um, healthy markers that are showing that colonocytes or
Yeah,
if there are any markers of
elastase.
inflammation, we want to
Right.
make sure that their immune function is pretty good in the colon, in their
Yeah.
gut. Um, and then we can also look and see maybe there's some food sensitivities or allergies that are causing digestive irritation.
Right.
Um,
It's a big
because
one.
it can be
Yeah.
a cycle, allergies cause irritation, irritation causes allergies.
Yep.
Is there impermeability in the intestine? Things are leaking through to our bloodstream. And
Yep.
then we treat individually based on what each person needs.
Right.
Two people with constipation can be totally different. It could
Totally
be
different. Yeah.
stress, even with our children, we don't think about that, but
Right.
it could be stressfully
Yeah.
withholding their stools.
Absolutely. Yep.
They hate going to school or they hate the tests. And so
Right.
how does our bodies can't relax? So digestion is part of
Yeah.
our rest and digest, our parasympathetic. If our nervous system is too wired or we're too stressed out, we're not going to go to the bathroom. So
Yeah.
we'll look at that as well. And then there are nutrients, herbs, or probiotics that we can add to
Yeah.
help support a healthy flow.
Yeah. Diet changes. I mean, we have so many tools in the toolbox for this. It's kind of exciting, and it's great to catch these problems young, right? Because we see patients coming in who've had these problems for 20 years, or they tell us, I've had this problem since I was a kid, and if we can catch these problems young, we're setting these kids up for better health throughout their lives. So it's good work that you're doing there. So thanks for joining. And
Thank you. Thank you as well. It was a pleasure talking with you
it's
today.
super interesting.